dystrophy is an abnormality of the cornea. The cornea is the piece of tissue at the front of the eye. In order for you to see well, it has to be thin and clear like a piece of glass so that you can see through it. The cells that help keep the cornea clear are the endothelial cells. These are the cells that line the inside layer of the cornea. They actively pump fluid out of the cornea to keep it in a relatively dehydrated state. If you have a decreased number of them or they're functioning suboptimally, the cornea starts to become swollen. When the cornea becomes swollen and edematous, it becomes hazy and difficult to see through. So people with Fuchs dystrophy, they have an abnormality in these endothelial cells. Not only do they have a decreased number of them, the ones that they do have are not functioning properly. So these patients suffer from decrease in vision as well as foreign body sensation and irritation of the eye. Uncomplicated normal cataract surgery is somewhat traumatic to the cornea. Even normal cataract surgery is traumatic to the cornea. Now, in the average person who has healthy endothelial cells on the cornea, we don't care. You have enough endothelial cells to spare, so we know that if we knock off some of them, you're still going to do just fine because you don't need all of them. Now, in somebody with Fuchs dystrophy, it's more of an issue because they need every single cell that they have. So it's important that when you're going for cataract surgery, if you do have Fuchs dystrophy, the doctor needs to be aware of it and take extra precautions when doing the surgery. There's certain viscoelastic that can be injected into the eye during the surgery that helps, it actually coats the cornea and acts as a layer of protection for those endothelial cells. The phacoemulsification you want to use as little energy as possible and do the cataract surgery as quickly as is safely possible. One of the nice things that we have here at North Shore Eye Care is we have a femtosecond laser-assisted cataract surgery, and one of the benefits of doing cataract surgery with the laser is that it's actually able to soften the cataract or the lens that's inside the eye. So when you go to remove the lens, it requires less energy to remove it because it's already been pre-softened by the lens, which is invaluable when you're trying to protect those endothelial cells on the cornea. The recovery process with cataract surgery in somebody without Fuchs dystrophy, by the next day they're feeling really good. Somebody with Fuchs dystrophy might take a little bit longer recovery-wise. Instead of taking a day or two, it might take a week or maybe even a little longer, depending on how severe the Fuchs dystrophy. But in the end, in almost all cases, the cornea does bounce back. It just takes a little bit longer. So if you're suffering with cataracts, or if you have a diagnosis of Fuchs dystrophy, or if somebody in your family has a diagnosis of Fuchs dystrophy and you'd like to find out more about it, please call one of our offices today so that you can be evaluated.